field.
Oh, you know, this
I don't know any of this.
You're excited about this.
I know. It's bringing me back.
Oh, really? Well, this is, I'm here. I need to eat.
Okay, let's pick it up. Let's talk about the sphenoid now. There's only one sphenoid, and the way to kind of think of the sphenoid is it looks like a big giant bat. So this would be the body of the bat, and you have multiple wings coming away from the bat. And so you have lesser wings and then greater wings associated with the bat. As you look at the sphenoid is actually very important because it's actually going to create a connection between a lot of the facial bones and the bones of the cranium. So it acts as a bridge uniting the cranial and facial bones. The lesser wings, again, the sphenoid, you can see here. The greater wings of the sphenoid, you actually can see laterally. So if we go outside of the skull, you actually can see a little bit of the greater wings outside of the skull. As we look at this, the lesser wings, the first thing we can see is the central body area. And a lot of this area is known as the sella turcica. And in the middle of the sella turcica is a fossa called the hypophyseal fossa, where the pituitary gland sits.
That's where we learned it from.
So that name should sound familiar, hopefully. Also associated with the lesser wings, so this is sort of the body of the bat where that sella turcica is, and then coming away from that towards the lesser wings, are these openings here. And this is the optic foramen, which leads to the optic canal. The optic foramen, which leads to the optic canals, one on each side. And you can see those here as well. Optic foramen, which leads to the optic canals. These are going to be important because they transmit cranial nerve number 2, the optic nerve. Cranial nerve number 2, as well as the ophthalmic artery. Also from this view, you can see as we come down towards the greater wing, you can see a little slit here and here. This is the superior orbital fissure. And you can really can't see it real well because it's sort of tucked under the lesser wing here. But again, that's to be the superior orbital fissure. The superior orbital fissure is going to be important because it's going to transmit cranial nerves 3, 4, 6. 3, 4, and 6. As well as the ophthalmic branch of 5. Remember the ophthalmic branch of 5? Way back when? We look at the frontal.
Superior orbital fissure. Thanks.
We saw there was a branch of the ophthalmic that came this way. Well, somehow we have to get the ophthalmic nerve heading this direction. So it's going to go through that superior orbital fissure, then it's going to send that little branch up here and onto the forehead. So sphenoid is going to transmit 3, 4, and 6. And what we'll learn about is 3, 4, and 6 are going to innervate the 6 extrinsic eye muscles. So it makes sense that it has to get into the orbit to innervate the extrinsic eye muscles, the skeletal muscles that allow you to look at different things in space. And then the ophthalmic branch of 5. But as I said, cranial nerve number 5 also has other divisions. How do they get out? Well, if we head back from the superior orbital fissure, you see 3 holes in a row. This is going to be the foramen rotundum, the foramen ovale, and the foramen spinosum. Now the spinosum is very small. That last one is very small. And going through the foramen spinosum is going to be the middle meningeal artery. But the other 2 divisions of the trigeminal are going to go through the rotundum and the ovale. Through the rotundum will be the maxillary division, and through the ovale will be the mandibular division.
say goes to the spinosum again?
Going through the spinosum is going to be the middle meningeal artery, so it's gonna serve the meninges, so things like the dura mater.
And did you say the maxillary was coming from the rotundum?
The maxillary is gonna go through the rotundum, and the mandibular goes through the valley. So the way you can kind of think of it is this very large cranial nerve comes off on each side of the brain, and it's gonna be the trigeminal nerve, and it's gonna be cranial nerve number 5, and it immediately splits into 3. So those 3 parts have to go through something. So we're gonna see that the ophthalmic division is gonna go through the superior orbital fissure, the maxillary is gonna go through the foramen rotundum, and the mandibular is gonna go through the foramen ovale. And ovale means oval shaped, and we're actually gonna see there's a number of foramen ovales in the body, including in the heart. Questions? So here we see the orbit, and so you can see that the posterior wall of the orbit is actually the sphenoid bone. Remember, the orbit's 7 different bones. One of those bones is going to be the sphenoid, makes up the posterior wall. You can see the opening of the optic canal here for transmission of cranial nerve number 2 for vision. And then the superior orbital fissure for 3, 4, 6, and the first division of 5. From this view, we also see that the bat has legs associated with it. These legs hanging down. And these are called the pterygoid processes. The pterygoid processes. Pterygoid processes are those vertical projections, and we see that each is composed of different plates. We're going to see that there is a lateral plate and a medial plate. A lateral plate and a medial plate for each one of these. I mention these plates and these processes because what we're going to see is that they are important sites for attachments of muscles that move the lower jaw and the soft palate. So muscles are attached to the pterygoid processes at the medial and lateral plates. Those will be important for moving the lower jaw and the soft palate. So here is the pterygoid processes. This is the lateral plate, this is the medial plate, this is the medial plate, this is the lateral plate. And in between is a fossa called the pterygoid fossa. So the whole thing is the pterygoid process, medial and lateral plate, and there's a fossa in between called the pterygoid fossa. Bless you. Everybody's very sneezy today. So this is just another way to look at the different bone, look at the sphenoid bone from different views and the different foramina, fissures, fossas, and so forth that we talked about. Then we have the ethmoid. You only have one ethmoid bone. It's part of the orbital wall, so it's coming out as part of the orbit. It's also making up the anterior medial floor of the cranium, so a little bit of the anterior and medial portion of the cranium. Roof of the nasal cavity and part of your nasal septum. The reason why I mention all of this is because to find it, you're only going to find pieces of it unless it's in isolation. So if we go inside the skull, you can see it's making up a little bit of the anterior cranial fossa right here. If we look at it from a superior view, that's going to be this area right here. From an anterior view, you can see it's making up a portion of the medium septum through the perpendicular plate. So you can always find that perpendicular plate, and that perpendicular plate is part of the septum of the nose. So as we look at this bone, the part we see inside the skull is this here. It's known as the cribriform plate. That cribriform plate has holes in it called the cribriform foramina. These cribriform foramina are important because coming through the cribriform foramina of the cribriform plate are cranial nerve number 1. And sitting on top of the cribriform plates will be the olfactory bulbs. So the olfactory bulbs sit right here. And coming through the holes here are cranial nerve number 1. At the center of the cribriform plate is this little ridge of bone called the crista galli. The crista galli. This is important because a fold of the dura mater is going to attach here that we'll talk about later. So we go inferiorly, there's that perpendicular plate. That perpendicular plate is important because it's going to be connecting with the vomer bone and a piece of hyaline cartilage to create the nasal septum. So helping to make the nasal septum. And the other place you can pick up the ethmoid bone, besides just a little bit in the orbits, is also these scrolls of bone. These are known as the middle cranial, the middle and the superior nasal concha. Middle and superior nasal concha. These concha are scrolls of bones that project into the nasal cavity on either side of the perpendicular plate. And they're going to break up the airflow as they come into the nose to slow it down so it can be warmed and moistened and filtered before it gets to the more delicate portions of the respiratory tract. So if we go looking for the ethmoid bone from this view, we can find a little bit of the ethmoid bone here in the orbits. So it's one of the 7 bones that are making up the orbits. You can see it's the perpendicular plate of the ethmoid bone here. These are the middle nasal concha, and the superior nasal concha will be way up inside of the skull. And let's see. And here in this image here, here's the cribriform plates. So the olfactory bulbs will be sitting around there, and there's the crista galli sticking up there. So when it comes to the ethmoid, you can just kind of find pieces of it sticking out in certain locations. Questions on the ethmoid or the cranium? Let's talk about the bones of the face. The bones of the face are all paired except for the mandible and the vomer. There's 14 bones, you can see them listed here. The only movable bone of the face is going to be the mandible. What do they do for you? Well, we're going to see that the facial bones are going to form the framework of the face. They contain cavities for special sense organs of sight, taste, and smell. They provide openings for the respiratory tract and openings for the digestive tract. They secure the teeth and anchor the muscles of facial expression. Those muscles that allow you to communicate non-verbally to someone else just by moving the skin of your face. The next couple slides are just going to take you through the bones of the face so you can get a look for them, so you can utilize these to help look for the different bones. You can see the mandible in this area here, the 2 maxillae, the vomer bone, the zygomatic bones in this area here. From a lateral view, from this lateral view, you can see the zygomatic bone, you can see the nasal bone, you can see one of the maxillae, the mandible. One thing to point out from this lateral view, although not a bone of the face, but this bone right here, this is actually a little bit of the sphenoid poking through. And this sphenoid, remember, that's the greater wing of the sphenoid that's poking through, and that's actually a bone of the cranium, though. So let's talk about the maxillae first. There are 2 of them, and they're the largest facial bones, and together they form the upper jaw. They articulate with all the other facial bones except for the mandible. The oral margins of the maxillae form the alveolar processes that contain the upper teeth. So these are known as the alveolar processes, and they hold the upper teeth. I'll point it out, but we won't talk about much of what goes through it, but you can see that part of this passageway in the orbit, so the floor of the orbit, as I will mention, and you're responsible for, the floor of the orbit is going to be the maxilla bones, but you'll notice that there's also a little passageway that is going to be right along the edge of the maxillae, and this is the inferior orbital fissure. So you are responsible for finding it, but we're not gonna talk about what goes through it. But this is called the inferior orbital fissure. So there's a superior orbital fissure and an inferior orbital fissure. The maxillae are going to have very large sinuses, which are part of the paranasal sinuses in this area here. That's why when you go to the doctor again, when they're checking, they tap on here to see if you have any pain associated with that area, in case you have a nasal infection.
That's cool.
This view. So here again, we're looking at one of the maxillae. So this is a maxilla. You can see the alveolar process here. And you can also see that there's this extension that comes away from the maxillae as well. And this is known as the palatal process, or the palatine processes. Palatal processes or palatine processes. So this structure here that we're looking at is actually the hard palate. This is the hard palate. And the hard palate is formed from the palatine processes, both of them from the maxillae, and the horizontal plates of the palatine bones. And we'll talk about palatine bones or palatine bones in a few minutes. Here you can see the maxillary sinus. Like in this area right here. One other structure to point out, which you can see in both of these images, is going to be the infraorbital foramen. There. You can also see it in this one, the infraorbital foramen. Here. Here. Coming through the infraorbital foramen is the infraorbital nerve. The infraorbital nerve is a branch of the maxillary division of the trigeminal nerve. The infraorbital nerve is a branch of the maxillary division of the trigeminal nerve, so the second division. Next are the palatine bones or palatine bones. We're going to see that there are two of them and they're shaped like an L. So this is both of them together. So they look like two L's that are coming together like this. If you want to find them, you can look for this horizontal plate portion here or the very tips of the palatine bones as well. We've already talked about the fact that the horizontal plates of the palatine bones, because they look like L's coming together like this, those horizontal plates make up the posterior portion of your hard palate. Now, if you're looking for the tips, those upper tips, right here, these actually end up in the orbits. So one of the 7 bones of the orbit are actually the palatine bones. So find that portion. Here's the superior orbital fissure. Go to the bottom of the superior orbital fissure. Right there is the palatine bones. Next are the nasal bones. The 2 nasal bones, seen here and here. not real exciting, except for the fact that hanging off the inferior margin of these bones is gonna be the flexible portion of the nose. So that hyaline cartilage that makes up the flexible portion of your nose is gonna hang off the inferior margin here. Then have the inferior nasal concha. So before, when we looked in the nose and we looked out laterally here. We looked out laterally, there's those scrolls of bones. There's gonna be the superior nasal concha, the middle nasal concha, and there's an inferior nasal concha. The superior and the middle are part of the ethmoid bone. The inferior nasal concha are actually bones in and of themselves. So those inferior nasal concha are actually bones. We then have the zygomatic bones. These are also paired, 2 of these. We've already talked about these before, but here is the zygomatic bone. And that zygomatic bone has a process that goes back posteriorly. That's the temporal process of the zygomatic bone. So the temporal process of the zygomatic bone meets up with the zygomatic process of the temporal bone to form the zygomatic arch. Next are the lacrimal bones. You have 2 of these. This is the lacrimal bone here. It helps make up a portion of the orbit. And I should mention now, we've actually talked about all 7 bones of the orbit, whether I mentioned that or not. But if we look at the bones of the orbit, the roof was our frontal bone, the floor was our maxillae. We're then looking at the lateral wall. The zygomatic bone was actually making up a portion of the wall. The posterior wall was the sphenoid, and then as we come around, we pick up the last of the bones. That's going to be the palatine, that's going to be the ethmoid, and this is going to be our last bone, which is going to be the lacrimal bone. So the lacrimal bone is situated in the medial portion of the orbit. It has a shallow groove in it called the lacrimal groove. A little groove in there called the lacrimal groove. And that leads to a narrow passageway called the nasolacrimal canal. The opening to the nasolacrimal canal. So this is the groove. If you follow that down, it goes to the nasolacrimal canal. The nasolacrimal canal is going to contain the nasolacrimal duct. So the duct is the soft tissue structure within the bony portion, which is the canal. And that nasolacrimal duct is going to pass towards the nasal cavity and dump into the nasal cavity behind the inferior nasal concha. So this leads all the way down to right behind the inferior nasal concha and dumps into the nasal cavity. That's why when people cry, a lot of times their nose starts running because a lot of those tears go through that nasolacrimal duct all the way down to the nose. And so what's actually coming out of their nose potentially is going to be a lot of tears.
That's cool.
So it connects the orbit to the nasal cavity. Next is the vomer. There's only one of these, so it's an exception to the group. And it forms the inferior portion of the nasal septum. So you can see that vomer bone popping up right here. It's meeting up with the perpendicular plate of the ethmoid bone. We take a mid-sagittal section. Here's a perpendicular plate here of the ethmoid bone, and it's coming down and articulating with the vomer bone, which sits on top of the hard palate and articulates with it. So that vomer is articulating with both maxillae and the palatine bones along the midline, heads superiorly and articulates with the perpendicular plate of the ethmoid bone, and helps to support the cartilaginous extension of the nasal septum. So there's a piece of cartilage that's going to hang off the front portion of this nasal septum, and the vomer along with the perpendicular plate of the ethmoid bone are going to help to support that. That piece of cartilage is known as the septal cartilage, and we'll look at that in a minute. We then have the mandible, which forms the entire lower jaw. And this can be divided into 2 parts. And there's the body, which is the horizontal portion. And then there's the rami, which are gonna go superiorly. So the bone can be divided into the horizontal body and the ascending rami of the mandible. The ramus will meet, this portion, meets with the body at the angle of the mandible. So you can feel the angle of your mandible right here. That's your angle of your mandible. Mandible also has an alveolar part or alveolar process for the teeth, just like the maxilla did. The superior end of the rami divide into two parts. And there's two names for this, so I need to make sure I get this right. So you can see it comes up and splits into two pieces. The posterior portion is known as the condylar portion. You may also hear the condylar or, let's go with condylar process. This condylar process is going to be important because it's the most posterior portion. On the end of it is a condyle, so that's why it's called the condylar process. Can anybody tell me what that condyle articulates with?
I'm sorry.
What does this articulate with?
Is it the temporal bone, like somewhere?
It's on the temporal bone, good.
Maybe like what's the thing, the process,
Right behind that.
it's behind I'm trying.
Mandibular fossa.
Okay.
So it's the mandibular fossa of the temporal bone. So that's where your temporal mandibular joint is forming. Right here. Up front is the coronoid process. The coronoid process, it's more anteriorly. It's where the temporalis muscle is going to insert. Temporalis muscle is going to insert, and it's very forceful muscle for closing the mouth. Okay, so the ramus comes off. It has a posterior portion, which is the condylar process for the temporal mandibular joint. It's going to have an anterior process, which is the coronoid process, which is going to be attachment for the temporalis muscle.
So the temporalis muscle, can you say that one more time?
Temporalis muscle is going to attach or insert onto the coronoid process. It's
Oh,
very,
okay, that's the part I didn't.
it's forceful muscle for closing the mouth. Separating the two processes is the mandibular notch. So this is the mandibular notch. Anteriorly on both sides, there's an opening called the mental foramen. So you have mental foramina right here. Coming through the mental foramina are the mental nerves, which are branches of the mandibular division of the trigeminal. Mandibular division of the trigeminal. And that mental nerve gives you sensory fibers for a little bit of the cheek, a little bit of the lower lip, the chin, lower lips, a little bit of the gums in that area. Two other structures I need to mention associated with this. The genoid tubercle is right here. Genu means a bend in something, and so the genoid tubercle is right behind the chin in this area here. That will be important for attachment of muscles.
What did you say genu meant?
A bend. So if you heard the term genuflect, it's bending of the knee. That's where it comes coming from the same root. And then also, I need to mention on the inside of the ramus is this mandibular foramen. The mandibular foramen enters the mandibular canal, which transmits what's called the inferior alveolar nerve. And the inferior alveolar nerve sends sensory branches to the teeth and then pops out the mental foramina as the mental nerve.
The mental foramina?
the mental foramina, the one that was up front. So if you have work done on your lower teeth, what the dentist will normally do is take the needle and we'll slide it along here, and we'll look for the inferior alveolar nerve, which is coming in here. They'll put the anesthetizing agent right in here, and that's gonna anesthetize everything downstream from that point. And so it means the teeth of the lower jaw on this particular side, but it also anesthetizes then the mental nerve, and so that's why your lower lip and everything else is real numb as well. So that inferior alveolar nerve is a branch of the mandibular division of the trigeminal nerve. So if you, let's see, if you kind of break it down to what we looked at now, if you look, almost in the same sagittal section are these three holes or foramina. You have the superior orbital foramen with the superior orbital nerve, the infraorbital foramina with the infraorbital nerve, and the mental nerve coming out the mental foramen. This was a branch of the first division of the trigeminal, this is a branch of the second division of the trigeminal, and this is a branch of the third division of the trigeminal. So it can kind of explain where those different divisions are intervening the face. So we talked about the nasal septum. This kind of just brings us all together. And so if you look at the nasal septum here in this mid-sagittal section, you can see that that nasal septum posteriorly is made up of bone and anteriorly is made up of hyaline cartilage. Posteriorly, we're going to have the perpendicular plate of the ethmoid bone. Below that's going to be the vomer bone, and then anterior to that will be what's called the septal cartilage. A deviated nasal septum is one that's going to be deflected to the right or to the left of the midline, and it can occur as through trauma, it can occur as developmental abnormality. If the deviation is serious, it's pushed too far to the right or the left, it can actually impact breathing through the nose, and then it'll have to be corrected surgically. We also talked about the paranasal sinuses in the frontal bone, the ethmoid bone, the sphenoid, and the maxillary areas. This allows you, these images here allow you to see these different sinuses. You can see the frontal sinus here. Also see frontal sinus here, frontal sinus in here. Ethmoid air cells. This is your ethmoid bone, and if you look in that ethmoid bone, you can see these air cells that are here. You also then behind that posteriorly will have the sphenoid with its sinuses, and then the maxillary here and here. And remember, these all connect back to the nasal cavity. They all connect back to the nasal cavity. So when you think about the ethmoid, when you think about the frontal sinuses, think about superior to the eyes, the orbits. Ethmoid air cells, also known as the ethmoid sinuses, several compartments separated deep in the nasal bones, nasal area. Sphenoid behind that, and maxillary is going to be inferior to the eyes in this area here. The interesting thing is, remember, these all connect back to the nasal cavity for drainage, but if you look at how the maxillary sinuses work, your maxillary sinuses almost have to completely fill up before they start draining into the nasal cavities. And so that way, if for some reason you would have sinus infection of your maxillary sinuses and you need to drain them, the best thing is to lay on one side of your face and then lay on the other side of your face to be able to drain them. And here you can see those different spaces. We talked about, bless you, we talked about the cranial fossa. Here you can see how the brain has this stair-step pattern associated with it, and you have that same stair-step pattern associated with the interior portion of the skull. And so it creates different fossa. So you have the anterior cranial fossa, which really is mostly frontal bone. The middle cranial fossa, which will need a lot of sphenoid and temporal. And then the posterior cranial fossa, which is going to be mostly occipital bone. What sits in these in the anterior cranial fossa will be the anterior lobes of the cerebrum. Sitting in the middle cranial fossa will be the temporal lobes, anterior portion of the temporal lobes of the cerebrum. And sitting in the posterior cranial fossa will be the brainstem and the cerebellum, this portion here. Lastly, just they mentioned the infant skull. The infant skull, fetal and infant skulls, there's large fibrous areas where several sutures meet, creating which are areas called fontanelles. So you have things like the anterior fontanelle here, the posterior fontanelle here, and it's where the sutures are coming together. And very often these fontanelles are going to be important because they allow for the molding of the skull during childbirth. So it's, the fontanelles are important for the distortion of the skull during birth and allows for the cranial expansion during childhood. And so the softness of the bones, the sutures, the fontanelles all allow the calvaria to undergo changes in shape during birth called molding. That's why when a baby's initially born, sometimes the skull looks a little strange because it's gone through this molding process and it takes a day or so for the skull bones to go back to their original shape. So this loose construction also allows for the skull to enlarge and undergo remodeling during infancy and childhood. The largest increase in size of the cranium occurs during the first 2 years of life. Fontanelles typically disappear by the time of 4 years of age. Yeah.
How come those aren't considered diaphragmatic in that stage like it is in the pelvis? Because if you see the pelvis, like as a child, it's diaphragmatic.
I think they're not, at this point, I'd like to look up what the true definition of fontanelle is, because I think it's more considered not a connection between bones, as more as a piece of soft connective tissue. And it's more the sutures that are really the connection pieces. It's a good question, though. Last thing to mention is the hyoid bone. We'll talk about the auditory ossicles when we get to hearing, but the hyoid bone, remember, this is, there's only one hyoid bone, lies inferior to the skull. And if you ever end up on Jeopardy, this bone's important because it's the only bone in the body that doesn't articulate with another bone. So if you ever, it does end up being a Jeopardy question occasionally. It's suspended from the styloid process. You can see the styloid process is going to be up in this area. It's going to be suspended from the styloid process of the temporal bone by the styloid ligaments as well as muscles. Located in the anterior portion of the neck between the mandible and the larynx. It serves as an attachment point for several muscles that are involved with things like the tongue, the neck, the larynx, the pharynx. Has a horizontal body and 2 horns, sets of horns that come off, lesser horns and greater horns. And the hyoid bone, along with the cartilages of the larynx, are often fractured during strangulation, and so very often they're carefully examined during autopsies when strangulation is suspected.
You said it's the only bone in the body that doesn't articulate with.
Another bone in the body. So it just kind of hangs there. So if you didn't notice, we actually went through all the cranial nerves and talked about how they got out of the skull. This is actually how they got out of the skull. This is the foramina that they're going to utilize. So this is helpful when filling out the chart in the back of the book. The last slides, and again, this does the same thing as well. The last slides are going to basically just be tables that talk about everything that we talked about today. It goes through each bone, talks about different fissures, foramina that are associated with it, and what structures go through them. First talking about the cranium here, and then talking about the face. If you're more of a table person, that'll be useful. So.